Well, good morning. Thank you all for coming. It makes me really happy to see lots of people here and more importantly, lots of men around because usually men always forget that they may have this problem. So what happens when things go wrong in the form of osteoporosis? Now, Mike has spoken to you about the wonderful cells that are sitting in our body, talking to each other that sort of remodel and change the shape of your bone whilst you and I are sitting there while I'm standing here. Now, these two cells, the osteoclasts that take away bone and osteoblasts that form bone, usually they're very much in balance constantly. Otherwise, we'll become like jelly if one goes too much. Oh, there we go. Too little resorption, but you get osteoporosis, very rare. But if you have too much resorption, so too much bone being taken away, that's when we get osteoporosis. So osteoporosis is characterized by, this is the WHO definition of osteoporosis, it's characterized by low bone mineral density and microarchitectural deterioration of bone tissue. Thereby, they result in decreased bone strength, increased fragility, and an increase in fracture risk. Now, this is, as we said, this is normal-looking structure bone, and this is osteoporosis, where the bone has lost its structure, and thereby it's quite weak and will fracture. Now, fractures are the serious clinical consequences of osteoporosis. So, osteoporotic fractures come with significant disability, with loss of quality of life, and independence. So how often have we seen people having fractures and end up, they don't go home like they usually do when they manage, even just a simple like a fracture of your wrist, you're unable to do your usual things at home. Thereby you have morbidity because you're just having to live with the consequence of the fracture. And this is where things are a bit more interesting, where we now know that fractures carry an increased risk of death. Now, this has always been known for hip fractures, where I was always taught the rule of threes, where 1/3 of people after a hip fracture will die, another third go to a nursing home, and then only a third go back home to living their usual life. But now we also know that the increased risk of death is also associated with many other types of fractures. Why, we do not know yet, but lots of work is being done in this area. And costs. Fractures cost money. Now, how common is it? So this is the burden of poor bone health in New South Wales in 2017. So just under 2 million age over 50 have some form of poor bone health, either osteoporosis or osteopenia in 2017. And by 2022, this is estimated to increase to just over nearly 2.1 million, so a 26% increase from 2012, equates to 174 fractures per day among older people. That's about a 30% increase. And men actually account for up to 30% of all fractures. Thereby, the direct and indirect costs are just about $7.5 billion over 10 years. So in short, it is common and costly. Now, this is data that's from the double osteoporosis study that a group that we've been following over 20 years. Now, it's not just hip fractures. Virtually any bone in your skeleton can fracture due to osteoporosis. We've collected data for men, for women, as you can see. It's your clavicle, your humerus, your rib, and pelvic fractures, your forearm fractures. So what can you do? Now, anybody who's age over 70 or have a risk factor should have a bone density. This is a machine where you lay on and you can get your bone density measured. Now, I want all of you, we may not look like this, but we all feel as good as this. So this is the criteria that WHO uses for the diagnostic criteria for postmenopausal osteoporosis, or realistically anyone age over 50, based on bone density, where your category is normal with a T-score of -1 and above. Low bone mass is osteopenia between -1 and -2.5, and osteoporosis is -2.5 and below. But realistically, it's a continuous spectrum that we're measuring. Everyone thinks because in the pictures, it's this old elderly lady who gets the fractures. But actually, sampling a group of over 900 GPs, the majority of people who are reporting fractures are actually the young old, so people in their 60s to 70s. So this is women sampled from 900 GP practices, other fractures, wrist fractures, clinical spine, ankle, hip. You can see the bulk is actually in the 60s to 70. Why is this so important? It's because usually we're missing the first fracture. So we want to capture the first fracture so that we can treat people and prevent the next fracture. But let's put it in context with other diseases, because I think we're all very hyped up about diabetes, cardiovascular disease, because they sound sexy, right? So let's put it in context. The lifetime risk of common diseases in women from the age of 50, your chances of getting any osteoporotic fracture is 1 in 2. Chances of hip fracture is 1 in 6. A clinical vertebral fracture, so clinical spine fracture, and we mean clinical because too often people don't actually turn up to their doctor to say they've got back pain. Usually it's silent. Is 1 in 4. Now, cancer at any site from the age, from young, it's 2 in 5. Breast cancer, 1 in 8. Coronary heart disease, 1 in 4. Thereby, for a 50-year-old lady, her lifetime risk of death from hip fracture is about 3%, which equates to breast cancer at 3%. So like I've said, this is lots of unrecognized people why vertebral fractures, spine fractures. This is where unrecognized spine fractures on X-ray, number of people on the vertical column, and the fracture was present in about just 1/8, 120 out of 934 women. Only 50% were mentioned in report, 23% were mentioned in summary, discharge summary, and sadly, 17% were diagnosed with osteoporosis, and less than 10% got onto therapy for treatment for osteoporosis. Now, I often get the question, why is that the case? It's because usually the way the spine is structured, you may not just fracture all at one spot. One day you pick up your grandchild, you might fracture a little bit, you lose that 10%, you go, I've got a bit of back pain, it's okay. Next time you go pick the grandchild again and you lose the next 10%, so it accumulates over time. Okay, so I'm just going to skip this because it's in visual time. Now, but how about fracture risk? So I love this diagram, right, okay? Now, your fracture risk is composed of how likely are you going to fall. Now, that usually can be because our vision's not so good or the rug's in the way. Now, slippers, those woolly slippers are quite dangerous. And then if you fall, how good are your reflexes to break the fall? Like if you have young and you bounce up, like our little kids, but we don't bounce so well when you get to my age. And then if you do, the reflexes fail, then you come down to this where, how much padding have you got? If you were really skinny and not have enough protein, you don't tend to block your hips as well. A bit more fat around the hips is good. Then only if that fails do you go down to the bone parameters where the bone density is. So because of that, we've actually in the Garvan, we've worked out the fracture risk calculator where you can input a few factors of how likely to fall and it works out your actual own individual fracture risk. Now to make it easier and simplify, this has all been put through to your knowyourbones. This website where you can actually take yourself through it. You put in your medical history, your falls risk and everything, and then it will give you, print your report, and you can bring it to your GP and have that discussion, that first step. Now, we're going to have a stand outside with this Know Your Bones, and people can take you through it as well, and we hope to see a few of you there. Thank you.